السلام عليكم ورحمة الله وبركاته. أهلا وسهلا بحضراتكم in case of the week 13 on our channel 4D Passion. This is a case referred to my center for second trimester anomaly scan due to short fetal bones. Here is the biometry of the case. You will notice that the fetal long bones are significantly shorter than and smaller than other biometry. The bilateral at 21 week plus 5 and the abdominal circumference at 18 weeks and the femur length at 15 weeks plus 1 day and the humerus length at 15 weeks plus 6 days. All fetal long bones are short. And the FLAC ratio is markedly diminished 14%. Whenever it is below 18%, you will suspect this is a lethal skeletal dysplasia. Is here 14. This is an important parameter to note at the biometry. You will notice here that the femur length is markedly lagging beyond the 5th percentile, and is about -9 standard deviation. His radius also is short, 15 weeks plus 6 days. The humerus length is also short, 17 weeks, when the tibia is 15 weeks plus 6 days. And here is an appearance of skull. The appearance of skull here is quite abnormal. You will notice that there is bitemporal pulsing. The temporal bones bilaterally are protruding outward. And this is the classic appearance of the so-called Cloverleaf skull. Here is the appearance of the Cloverleaf leaf, and this is the appearance of Cloverleaf skull. Again, Cloverleaf skull. This appearance is due to craniosynostosis of coronal, lambdoid, and sagittal suture. You will also notice it at the coronal view. You can see that the temporal regions are protruding outward at this 3D rendering. Also, you notice that the anterior fontanelle is markedly widened. Also, there is mild frontal pulsing and depressed nasal bridge. Again, the depressed nasal bridge. And here is the frontal pulsing on the sagittal profile view. On looking at the thorax, you will notice that the heart is apparently enlarged. Actually, it is not enlarged, but the thorax is small, so disproportionately the heart appears larger. You will also notice the short ribs. Again, the heart looks quite large in relation to the chest. And you'll notice in this sagittal view that the fetal thorax is significantly smaller than the fetal head that looks rather macrocephalic, and the fetal abdomen. The thorax is rather bell-shaped and so small. So the findings are markedly short straight fetal bones, marked rhizomesomelia, small thorax with short ribs, cloverleaf skull, depressed nasal bridge, frontal pulsing, wide anterior fontanelle. So the diagnosis is thanatophoric dysplasia type 2, a lethal skeletal dysplasia diagnosed by moderate to marked long bones shortening, thoracic hypoplasia, cloverleaf skull due to coronal, lambdoid, and sagittal suture craniosynostosis, frontal pulsing, depressed nasal bridge, macrocrania. More than thanatophoric dysplasia more rare than thanatophoric dysplasia type 1. Characterized by autosomal dominant inheritance, this in majority of infants soon after birth, on molecular basis caused by mutation in the fibroblast growth factor receptor 3 gene FGFR3. It affects growth. The infant will have dwarfism and lethal micromelia, head, neck, head, cloverleaf, head, face, small face, lung respiratory insufficiency, chest, external features, narrow thorax, ribs, sternum, clavicles, and scapulae, wide cupped costochondral cartilage, small abnormally formed scapulae and short ribs, skeletal skull, severe cloverleaf skull, small foramen magnum, spine platyspondyle, pelvis short and small iliac bones, small sacroiliac notches, limbs straight, femurs flared and irregular metaphyses, but this will be in the case of more in the case of thanatophoric dysplasia type 1. Hence, brachydactyly and prenatal manifestations such as diagnosed by prenatal ultrasound movement, decreased fetal movement, amniotic fluid, polyhydramnios. Differential diagnosis is by skeletal dysplasia characterized by micromelia and severe short thoracic hypoplasia, such as thanatophoric dysplasia type 1, bowing of femur and metaphyseal widening, French telephone receiver appearance of the femur, achondrogenesis, micrognathia, and severe hypomineralization. Hypophosphatasia, you will see ubiquitous hypomineralization, and type 2 osteogenesis imperfecta, which is characterized by fractures. And syndromes associated with Cloverleaf skull, such as Pfeiffer syndrome, different skeletal malformations, and the Cruzon syndrome, no limb shortening. The take-home message: in any skeletal dysplasia, focus on head and skull shape. The main clue to the diagnosis in our case with markedly short bones was Cloverleaf skull that led us to the diagnosis of a relatively common skeletal dysplasia, namely thanatophoric dysplasia type 2. Also remember that French telephone receiver appearance of femur is a main clue to the diagnosis of thanatophoric dysplasia type 1. Kind regards and see you soon. Dr. Amr Farouk. Assalamu alaikum wa rahmatullahi wa barakatuh.